So this was, I think, is a study that, aside from the innovative scientific data we show, has also a design that is probably what we are going to do for the next year, and I think a lot of other groups are doing something similar. So because in multiple myeloma immunotherapy is jumping aggressively into the treatment and is good for patients because it increases the depth of response, what we need to understand is why immunotherapy doesn't work in certain patients. For example, the treatment where we focus in the study was the DaraKRd, which means the monoclonal antibody anti-CD38 plus a proteasome inhibitor of second generation, Carfilzomib, Lenalidomide, and Dexamethasone. So this cycles is very effective, can achieve MRD negativity in 70-80% of the patients. But still, 20-30% don't get into MRD negativity, and almost half of the patients total will not sustain that, meaning they progress a certain point. So we're talking about a large fraction of patients. We don't know why this is happening. But because immunotherapy is involved, we need to investigate not just the tumor cells, but we also to investigate eventually the immune system and how the immune system markers and composition play with the tumor cells to create a sort of like complex interplay that allow the tumor to survive. So the design of this study was based on this, looking at the immune system and the tumor cells. There are two abstracts. One was the one I presented, 470. One was presented by Eileen Boyle, the 100. And the results of the genomic data show clearly that it's not one-hit resistance. Like in some tumor, if you have a mutation, you get resistant to a drug. But here, it's like much more complicated because we have multiple drugs, the patients have a different genomic background. And so what happened is that there are multiple alterations that we found to be associated with the resistance. That can create massively the complexity and the difficulties to understand how to identify these patients. So I think it's just the beginning of a very interesting journey, but there are clearly patterns of co-occurrence that we are investigating, and clearly certain patients that we know are high risk seems to not respond well despite the introduction of immunotherapy, in particular monoclonal antibody anti-CD38.